What is canine influenza? It is a highly contagious respiratory disease in dogs caused by the influenza A virus, specifically H3N8. Influenza A also causes flu virus in people, birds, pigs, and other animals.
Canine influenza is currently found in 34 states, including Virginia, as you can see on this map. It is found in all of the states surrounding Virginia as well. It was first found in greyhound racing dogs at a racetrack in Florida in 2003.
How do dogs catch the flu? Canine influenza is a type of flu virus and therefore extremely contagious. Almost 100% of dogs exposed to the illness will become infected unless they have received the vaccine or already have recovering from the illness.
Because the virus is relatively new, the dogs have absolutely no immunity towards this strain of influenza and therefore are very susceptible to catching it. But if the dog has already had canine influenza, they will have antibodies in their system and it will be less likely that they will catch it again.
Where do dogs catch the canine influenza virus? Only about 80% of affected dogs will show signs of illness. This means that 20% of dogs are sick without showing any symptoms, but still passing on the disease. So infected dogs can be anywhere.
Dogs can catch the disease anywhere that they see other dogs, such as dog parks, hospitals, groomers, etc. If there is one sick dog in any of these places, it can expose all of the other dogs, which in turn will almost inevitably catch the disease.
If you acquire your dog from any unknown place, such as a kennel or pet store, there is always a risk that that dog has the canine influenza virus. Also, dogs that frequently board and enter in dog shows, also any elderly or sickly animals are susceptible to this disease.
How canine influenza is spread. The canine influenza virus is spread in 3 ways, which makes it all that much easier to catch. Dogs can get it through direct contact, such as licking or nuzzling, through the air, such as coughing or sneezing, and through fomites, like dog bowls and people's hands.
Now we're going to discuss the symptoms. The most prevalent sign of canine influenza is a cough. Sometimes it is similar to the dry cough known as kennel cough, but many times it is a wet, productive cough. The cough is usually continuous and may last for up to a month.
Other symptoms that may help distinguish canine influenza virus from kennel cough include a low-grade fever, nasal discharge, lethargy, and loss of appetite or anorexia. There also is a test now that can distinguish any kind of kennel cough from canine influenza.
As we mentioned, the influenza virus is very hard to differentiate from the kennel cough, which is caused by any number of bacteria. Many times, canine flu is not suspected until the disease progresses to a more serious state or lasts for an unusually long time.
Many times, blood samples and nasal swabs will be taken, but unless it is the correct time during the illness, the test results will be inconclusive. The swabs and samples must be tested early on in the disease to result in a positive test. Many times, it will be before the client suspects their pet is even sick.
Canine influenza can lead to pneumonia and in some rare cases death. Therefore, it is imperative that the illness be treated promptly. Since there is no medical treatment, the only way to help the dog is through good, supportive care.
Continuing on with treatment options. Sometimes dogs may get a secondary infection while they have canine influenza. This can be treated by broad-spectrum antibiotics and supportive care such as a good diet, fluids, and rest. The best way, though, is to prevent canine influenza in the first place.
Prevention. There are many things to help protect dogs from the canine influenza virus. It starts with good health in general, making sure the dogs have strong immune system with a good diet, exercise, and rest. Following these steps can guarantee that your dog is way more protected against the canine influenza virus.
The canine influenza vaccine. Recently, there has been a vaccine developed for canine influenza H3N8 that has proven to reduce the severity of the disease if caught and help prevent the animal from catching the disease in the first place.
The vaccine is from Intervet Shearing and Plow, Animal Health, and requires an initial dosing of 2 vaccines 2 to 4 weeks apart, then revaccinations annually after that. This vaccine is given subcutaneously between the shoulder blades, as you can see in the picture.
Many owners are unsure of whether to vaccinate their dog for canine influenza because of cost and side effects. A good way to explain to a client if their dog should be vaccinated is if the dog is already receiving the Bordetella vaccine, it should probably receive canine influenza, since both of these diseases are contracted from exposure to other dogs.
This vaccine was proven safe and well tolerated in a study with 700 dogs, 30 breeds from 6 weeks to 10 years old. It is still, however, only licensed as conditional, which means that it's expected to be reasonably effective but is not 100%. This is important to explain to clients.
With this slide, we just want to show you a picture of contaminated lungs to prove how serious this disease can be and what a noticeable difference there is between the infected and non-infected lungs.
In conclusion, canine influenza is a very serious virus and it's very important to follow proper prevention methods.